the COVID update on this Wednesday, April 30th, right? Yeah, no, April 29th. So let me begin with the numbers here. Confirmed cases in the city of St. Louis, 1,116. It was just a few days ago that we hit the 1,000 mark. Confirmed deaths in the city of St. Louis, 60. St. Louis County has over 3,000 cases and 159 deaths. St. Charles has 587, 34 deaths. So still, and I guess this is probably not going to change, we have about 4,800 cases in this 3-county region, and that represents over 60% of the cases in the state. The state has 7,303 cases. Total deaths in Missouri so far, 314. The number of hospital beds, number of folks in the hospital, and this is something that we're watching. This was yesterday's numbers, 678. That's down a little bit. It's down 12 people from the day before and a few people from the day before that. Still, though, 159 people are in ICU and 113 people are on ventilators. So still an awfully serious health situation. You may know that Monday, the governor announced that most counties in the state of Missouri would be reopening businesses this coming Monday, May the 4th. So most counties in the state of Missouri do not have nearly as many cases or as much community spread as we do here in the St. Louis region. So right now, we are not going to reopen businesses at this point in time. We are still watching this day to day, watching the number of hospitalizations, and we hope very soon to be able to come together with a plan to have a limited or a phased opening of some of our businesses. So that's a little ways off for us here in St. Louis. We're going to keep watching the numbers. We're going to keep watching the number of hospitalizations so that we get to a point where we hope that we can do it safely without undergoing a big second wave of cases, because no one wants that, of course. So that is the update in terms of number of cases. Just a couple of very quick announcements in case anyone wants to tune in. Tomorrow at 10:30, I'm doing something which I think is going to be kind of fun. It's our kids' town hall. So we all know that the kids are all home from school now. And so some people were saying, maybe let's have a kids' town hall. So at 10:30 tomorrow morning, you can join into and watch on Facebook. We'll be taking questions from kids, 5th grade on down, kindergarten to 5th grade. And I think it'll be a fun morning. I really can't wait to hear the kids' questions. This is probably a pretty scary time for them. I would bet that when school was first canceled, everybody was pretty happy about it. It was like having, several snow days in a row. But by now, they might not be so thrilled about it. They're probably missing their friends and maybe even wanting to get back to school. So that's tomorrow morning at 10:30 on Facebook. And then tomorrow evening, we are having a neighborhood update. It'll be much like this update, except that this is for the leaders of neighborhood groups, block units, neighborhood associations. It's not an exclusive link. Anybody can get in on it. It is a Zoom meeting so that we can talk with people. And that's tomorrow evening at 6:30. So really just continuing to try to reach out and reach more people, kids and folks who are in neighborhood groups. I bet there are some leaders in neighborhood groups who are on these updates Monday, Wednesday, and Friday. But for those who aren't, they got a special invitation, and we'll try to put them over to get them to watch the Monday, Wednesday, Friday, 2 p.m. updates. So those are sort of the announcements. Now, on to what is a pretty serious situation. Some of you may be aware that there has been, or there is now, a pop-up encampment on Market Street from about 12th to 16th Street. And this encampment probably has about, it's in two different spots, just a block or two apart, has about 50 tents in it, has 50 or so people in it as well. It is a pretty serious health threat to have these individuals mixing it up, not practicing social distancing, living in this group situation. And so we will be moving those folks out of the tents on Friday morning. Now, what we're going to do here this afternoon, and we've been doing outreach to everyone. Our outreach team has been there day after day, trying to persuade people to go into the housing that we have for them. So far, we've been successful in placing about 40 people into housing, but more people have come. And of course, they're using the same tents that the other folks were in. And so that leads to a more high-risk health situation. Yes, furthermore, living in a tent is not something that's allowed under the occupancy laws of our city or our state for that matter. And to have them 24 hours a day, barbecuing, socializing, not practicing social distancing that we can persuade to go into shelter. And these beds are in 4 or 5 different locations. You've heard me talk about them. And so we will be doing that outreach. The other thing that we're doing starting tomorrow morning is through our health department and Affinia and BJC, we will be outreaching to them to do medical screenings, whether for COVID or whether it's for other medical conditions that they may have. And we'll be doing referrals to mental health services or other sorts of medical services that they may need. We all know that this is an underserved population, and we all know that they don't have adequate health care. So we think it's really important that we bring health care to them. We did this one other time last week with a physician and outreach workers who took masks and gloves, PPE, who did screenings, who talked to folks. But we are tomorrow and Friday, it'll probably go into Friday as well, going to have an Affinia van there, medical van, to talk with people, to do screenings, and all of us trying to persuade folks to go into housing, because we do have beds available for everyone who's in these encampments, probably around 50 people. We know because we know there are about 50 tents out there in the two. So probably around 50 people. So we are going to bring the medical screening to them tomorrow. We all know the bad weather, the rain. This is not a good situation for people to be out in, and we are going to do everything that we can to persuade them to please go into one of the shelter rooms or one of the shelter beds that we have available in 4 different locations across the city. So that is certainly something that we have been working very hard on, to bring additional beds online. Most of you know, because we've talked about it before, but a location known as Little Sisters of the Poor, the former Little Sisters of the Poor on Florissant, the Western Hotel at Broadway and 70, some rooms at Mark Twain Hotel. We are also bringing online rooms, beds really available at the former Booter Recreation Center. So that's coming online tomorrow night as well. So by Friday at 10 o'clock, we will have a place for everyone that we can persuade to go into housing. This is difficult for them to be there, but also our health director has said that this is just such a crisis, and so easy for any infections, COVID or other communicable disease to spread in this environment. Our fire chief has also expressed a lot of concern having all these tents, having a barbecue grill right next to the tent, having just very concerned about the safety of the situation, and been able to get enough shelter availability that this is just not a good situation. We're going to move people into shelter. That'll be on Friday. We've already announced that. Media already has a press release about it. We've already had some reporters calling for phone interviews. So this may be something you're all already aware of. I'm not certain if you are or not. So with that, questions?
A couple of questions about unhoused individuals. One is asking more long-term. This is a good short-term fix to get us through the epidemic, but long-term, what are your priorities for housing?
Thank you for asking me that. I should have already said that. So hopefully most of that we are what's called a housing first model, which means that you first need to get someone into stable housing before they can perhaps seek medical appointments, maybe have a job, maybe reach with people to help get improve their own situation. But it probably takes someone direct from the streets to an apartment. And so this is the short-term interim solutions. I have already made some calls, as have our human services individuals, to various apartment owners who might be willing to have some apartments, inexpensive but stable, good apartments available, so that we can move people from an encampment to shelter to transitional or permanent housing and stable housing, because that's what everyone needs. So thank you for that question.
Another viewer is asking for more specific about the rec center, Buddha Rec Center that you just mentioned, that will be temporarily serving those individuals. Will there be security, and is it going to be a place for COVID-19 cases?
No, it will not be a place for any positive cases. We have a contract that if we have an individual who is COVID positive, we have a contract, we've shared it with St. Louis County, this contract. There's a location for those individuals to go and have some medical supervision care, along with, assuming they don't need to be in the hospital, but a lower level of care. So there won't be any COVID positive individuals there. There will be security there. There will be shelter managers there. Folks food will be brought in every day. If you live in that area, I don't know where the person who wrote the question lives, but if you live in that area, you will see that since this past Saturday morning, we have had a lot of women there, and different trades, carpenters, really upgrading the Buddha Rec Center in order to make it appropriate for this use. We expect for this to be a short-term use. We needed to make sure that we had enough places for everyone who's in this encampment to go. What else? We've been working with Alderwoman Gracia on this. She actually made the first suggestion that we use Butter because it's a pretty underutilized building, although we did have about 30 kids there who would go there after school and that sort of thing. Now the rec center's been closed for a month or 6 weeks now, so that hasn't been happening for the last month or 6 weeks, but we would hope that this will be a short-term, we expect that this will be a short-term use. But you've seen the work trucks and you've seen people cleaning it out and going in and out of there, I'm sure.
Final question that we're getting related to unhoused is if someone is in need of a bed or in need of available shelter, what's the best available way to get connected to those resources?
Thank you for that. The best way to get connected is to call 211. There is also, I'll just say call 211. That's the United Way hotline. There's a second number as well, but I think that's the best way to know of someone who needs housing. That's a number that we use year-round Now we're using it and we're telling people about it for two main reasons. One, if anyone feels that they need someone to talk to from a mental health perspective, 211 and hit 1. That will get you to a mental health or behavioral health worker. And then secondly, this is the phone number. Thank you. Secondly, call 211 if you know someone who needs housing. The other number that I just mentioned, which is the housing hotline, and this only running the day. I think it's 8 to 5 or 9 to 6, but it's 318-802-5444. So both that number, 802-5444, or 211 work if you're someone who needs help.
So lots of questions about reopening and next phases after COVID-19. What do the city's current reopening guidelines look like, and how involved are small businesses in helping, like restaurants, to help shape what those look like?
So we have a task force working on this, and they are working with industry groups. So for example, there's a group of restaurateurs who are helping work on the reopening guidelines. There are hoteliers, so they're working on the hotel reopening guidelines. Although hotels are open now, but you have restaurants in hotels, you have ballrooms, you have gyms sometimes. So they're working on that. The Convention and Visitor Center, they're working with them. So each one of these industry groups, they're working on with us what the guidelines should be for their industry. So the question everybody wants to know, and we don't know that answer yet. We still are looking towards mid-May on that. So what is it? Friday is the 1st of May. So we're still looking at a couple of weeks here, we think. Now we're looking at these numbers every single day. And if we can begin to see, we do believe numbers have plateaued, and if we can begin to see them go down, then that will be a real plus. We know that people want to get back to church. We know they want to get back to their jobs. It's different. Everything that reopens is going to have to be social distance, and we're going to have to wear our masks. You know, my mask here that I'm going to talk to you, but I wear it regularly. So let me a second here to say it is the law. It is very strongly recommended that when you go outdoors or when you go to shop, let's say to Schnucks or Walgreens or wherever, please wear your mask. It's really important for a couple of reasons. One, let's think about the workers that work at Schnucks or the store or the convenience store. They don't need to have customers all day long breathing in their direction, sneezing, maybe anything. Just wear a mask so that you can protect the other people, and likewise expect other people to be wearing masks to protect you. So I'm just continuing to plug this wear masks idea. And I do see a lot of people out without masks. The other day, what day was it? I guess it was Sunday. I got in the car. I drove over to the grocery store. I only needed a few things. I drove into the parking lot of the grocery store, and I realized I didn't have my mask with me. So I drove back out, went back home. Fortunately, it was just a couple blocks away. Got my mask and went back to the grocery store. I just think that, you know, all of us have to try to continue to remember that and carry our masks with us, you know, in your purse, in your pocket, whatever for you, so that you do wear your mask.
Mayor, there have been a couple of announcements in the recent days about Missouri beginning to reopen on Monday, St. Charles, Jefferson, Franklin County, other local counties reopening alongside that. What are your thoughts on them reopening before the city gives us?
Well, I think it's difficult and I think it's confusing, but actually understand it. Missouri is a big state. There's 114 in the state of Missouri. Some counties only have a couple cases of COVID. St. Louis region has a lot of cases. As I said earlier, how many is it in total? Our 3 counties have 4,763. Those numbers are yesterday's numbers. So, one size doesn't fit all. I do think it's a challenging communication issue for all of us when one county does one thing and another county does another. But County Executive Page and I are in agreement that as this order is lifted and as people begin to gradually go back to work, we're going to try extremely hard for at least St. Louis and the city to be together on that.
You have some questions from hairstylists, Mayor. They'd like to know, are they allowed to open on Monday per the governor's order, and can you give the guidance for the city?
Yeah, you're not. And, if you're a hairstylist, you're probably looking at my hair today thinking, she could use a hairstyle. But it is just not safe yet. I mean, there's nothing more personal than a hairstylist. Washing your hair, coloring your hair, cutting your hair, styling your hair for customers.
Mayor, has the city made any final decisions about whether it will be opening our swimming pools over the course of the summer?
Right now, we do not expect swimming pools to open. However, I guess I reserve the right to sort of change on that, depending on how it goes with reopening some businesses. But right now, we don't see swimming pools opening. And that is sad for kids and adults, for that matter. But we don't see them reopening this summer.
Do you have an update on when schools in the city in the St. Louis region will be able to reopen?
So the schools in St. Louis City and the whole St. Louis County have already announced that they will not be opening this semester. So in summer school, I don't think they have made an announcement yet about that. And so as far as I know, schools will be closed for the foreseeable future. Hopefully they'll open in August as they should. And I think if we can all continue to tamp down this spread, practice social distance, our cases look a lot better. And then uis-mo.gov. And there's one that says, I know you probably can't read this, but it's posted on Facebook and Twitter. There's one that says /mayor/kids town hall. And there's another one that says /mayor/update. So, and it's got a blue back.
10 or so, and why is it still
detainees
still open, and how are we keeping them safe during COVID?
So that's a good question. So today we have about, I think it was 112, I looked at it this morning, 112 individuals detained at MSI, about 610 or 20 at CJC across the street downtown here. So the combination is about 720 or 30. And we had weeks ago, maybe a month ago by now, we stopped all visitors from going to either MSI or CJC. Any new individual that comes into CJC is seen for 14 days so that we don't just put someone new right into the population that's already been there. Of course, practicing social distancing and having the 2 facilities has actually enabled us to have a much less dense population in both places than it would be if we just had one facility open. So if you've been a regular here, you know that we did reduce the budget for MSI by about half. That reflects the lower number of people that are at MSI. And so that's good. We were able to use that money for other items in the budget this year, which is, we've got about a $30 million shortfall, $28 to $30 million shortfall, we think, in this year that we're still in, so April, May, June, and then probably a 40, maybe more, $40 to $70 million shortfall in next year's budget. We call it the 2021 budget, but it'll run from July of 20 to June 30th of 21. So, so that money that we saved in SI is helping to provide other services that the city needs to go on with. But we don't think it's a good idea to take everybody from MSI and put them all together in one location. The other thing I would say is this is the lowest number of detainees maybe that we've ever had. And that presents some of its own challenges. But I think that what we're seeing is an artificially low number of people being detained. Now, everybody who is being detained on a felony charge. So these are serious charges that are detaining people on. The city of St. Louis, the mayor's office, the jails, we don't make the decision about who is detained. That decision is made by the prosecutor, by the judges, prosecutor, defense lawyers, and by the judges. That's who determines who's detained in jail. We don't really have a choice about that. We don't get to decide who comes, and we don't get to let them out. So those are decisions made by the lawyers and the judges decide who stays in jail and who doesn't.
A good question for your seniors in the city of St. Louis who might need help with reasons. Is there a number or some assistance that the city might be able to offer during COVID-19?
So St. Louis Agency on Aging, SLAAA or AOA, does have a phone number if someone needs help, if an elderly person needs help. And that phone number is 612-5918. And, we've helped a number of individuals. And so if you know of someone who needs help, call 612-5988. Let me say, and I said it wrong, 612-5918. Or if you can help them, if you can go to the grocery store for them when going for yourself, great if you're able to do that.
2 testing questions, Mayor. The first, are we in a position yet to test essential workers who may be asymptomatic?
Well, if you're asymptomatic, then you would not meet the screening criteria. We want to get to the place where we can test all essential workers, first responders, but we frankly don't have the tests. The testing situation is a debacle. We have 220,000 tests ordered. We ordered them beginning back in March. They're not here yet. It has been it'll be here today. It'll be here tomorrow. It'll be here this day. So no, we don't have enough tests. Now, if someone feels that they've been exposed to someone else with COVID positive, or if there are other reasons that you believe that you need to be tested, certainly you should first call your doctor. If you have your own physician, call that individual. If not, call one of the federally qualified health centers and go to the screening and tell them what your situation is. So we all want more data. We all want more tests. And we thought a month ago, who would have ever thought that we would still be in this situation of not having enough tests? But we don't have enough. The county doesn't have enough. The state doesn't have enough. The doesn't have enough.
So you may have answered the second testing question, but that one is from Devin asking, what about just random people who don't have any symptoms, or are we at that point yet?
No. Some people call that buried well. In other words, you're well, you don't think you've been exposed in any way, you're just worried about it. There are not tests just to be able to get a test for the COVID.
Where is the city of St. Louis in the crest of overall cases? Are we at the top, headed down?
We think we're at the top, and we hope we're headed down. And you don't know if you're headed down until you look back. So that's where we believe we are right now.
Orthodontist offices, are they allowed to open on Monday?
So they're medical providers. they have been able to be open to provide medical care. Now, I think the order, and I don't have the order in front of me, but I think the order is, says for emergencies or whatever, you wouldn't just want to do a checkup. But orthodontists, dentists, they are allowed to be open now, and they have been allowed to be open.
That is all of our new questions.
Okay.
So if you want to
We're
offer
already
any
at
final
2:30.
thoughts or.
Final thoughts. Thank you all. Appreciate everyone who's.
Well, good afternoon, everyone, and welcome back to our 2:30 daily public of not only protecting our healthcare workers, our first responders, and our frontline workers, but also of our effort to reopen our economy. So I want to start today by updating you on our ongoing sourcing of PPE. We've now distributed nearly 20 million items of PPE to county public health departments, to hospitals, nursing homes, and nonprofit organizations in communities in every corner of our state, including all 102 of our counties. In total, we've sent out 10.1 million surgical masks, over 1.8 million N95 masks, over 173,000 gowns, over 7.7 million gloves, and over 440,000 face shields. I'm pleased to say that on Monday we received a shipment from the Federal Emergency Management Agency of over 300,000 N95 masks and over 500,000 KN95 masks, 1 million gloves, among other necessary supplies. And I'm grateful to our partners at FEMA for this support. We're also working with the federal government to meet the needs on the ground in Illinois for more gowns. We've submitted a critical needs request to FEMA for 900,000 gowns, making it clear that this is a priority for us. I have personally spoken with Vice President Pence about the importance of this ask. We also have outstanding orders with our suppliers due to arrive in the coming days and weeks, including an additional 17 million N95 masks and KN95 masks, 21 million surgical and general medical masks, 11 million gowns and coveralls, 14 million gloves, and 7 million face shields and goggles. All of the PPE at the state level is meant to supplement the stock at our healthcare facilities and other frontline organizations who normally source and stock their own PPE directly from distributors on a regular basis and at a regular rate. To help us stretch our PPE stocks further in our state, with the help of our federal partners, we recently acquired a new decontamination system currently deployed in Waukegan. This system can safely decontaminate N95 masks and is an entirely free service with turnaround time of about 24 hours. I can't overstate how important this in-state resource is to our ability to help our hospitals, our healthcare workers, our law enforcement officials, and frontline workers. Each N95 mask can be decontaminated up to 20 times without experiencing any degradation of filter performance. IEMA is disseminating the instructions for this service to all local emergency managers, health departments, and regional health care coalitions. And the information is also available on the Ready Illinois website as well. I highly encourage all healthcare entities, from hospitals to long-term care facilities, to take advantage of this equipment through IEMA. Again, it's fast, it's free, and it will help us help you. I also want to provide an update on our work at long-term care facilities around the state. 9 days ago, I walked you through our efforts to protect our elderly Illinoisans who call these facilities home. Starting near the very beginning of this crisis with our March 4th preparation guidelines, our early restrictions around visitors, and regular communication with our long-term care facilities, their governing organizations, and local public health departments. Those are some of the first policies that we put in place before we ever had a known nursing home case. And as the virus presence in Illinois has grown, so too has our ability to support long-term care associations and individual facilities in protecting their residents and frontline staff. So I want to highlight some new initiatives over the last week and a half. Let's start with testing. As I announced previously, we are working to test all residents and all staff for free at facilities without known COVID-19 outbreaks, allowing us to identify early the presence of COVID-19 in a facility and to isolate those cases before widespread transmission. And at facilities with known cases, we are ensuring that all employees can be tested for free, allowing us to determine who is coming in and out of an infected home, possibly asymptomatic, and should instead be at home in isolation. Since we started this expanded testing policy on April 19th, we've distributed over 18,000 swabs to 68 facilities for testing, with more to come. And to expand this effort, IDPH has secured a special contract with Quest Diagnostics to run 3,000 tests per day from Illinois long-term care facilities at no cost to the facilities. And Quest has promised to provide results in a 48-hour window, ensuring that IDPH, local health departments, and long-term care facilities have the answers that they need to act quickly and decisively to protect other staff and residents. Let's also talk about developments in staffing and IDPH's ability to deploy teams to facilities to assist long-term care staff and local health departments in responding to an outbreak. Local health departments are the first line of communication and support for our more than 1,000 private long-term care facilities in all elements of our COVID-19 response. That said, the Illinois Department of Public Health has prioritized protecting the healthcare workers and the residents at these facilities. These are some of our most vulnerable Illinoisans, and the state will do everything in its power to protect them. For many weeks now, we've deployed infectious disease control experts, advisors, and Project Hope volunteers to these facilities, and they will continue to operate as a part of our response. But beginning today, we're adding a new clinical support program to our ongoing protective efforts. Initially, we're deploying 10 teams of 50 nurses to homes across the state. Over the coming days, an additional team of 200 IDPH nurses will be joining their ranks to deploy to facilities across the state every day. Though their assistance will be tailored to meet each facility's needs, they'll be focused on 3 tasks: conducting swab testing, training existing staff to take samples themselves, and reviewing and improving the facility's hygiene practices and PPE use. With some homes low on staff due to sickness, IDPH and our Illinois Department of Financial and Professional Regulation have simplified the hiring process for long-term care facilities at this time so that they can bring on temporary nursing assistants to ensure that they have the healthy staff they need to care for all of their residents. That includes allowing our long-term care facilities to tap into our Illinois Helps network, where thousands of medical professionals in Illinois have indicated their willingness to volunteer their skills in the fight against COVID-19. And to support the care of facility residents recovering from COVID-19, we have worked with the Federal Department of Veterans Affairs to open up existing bed capacity at VA hospitals so that our seniors can isolate and receive medical treatment there if needed. As always, I want to offer my gratitude and the thanks of a grateful state to the frontline staff who dedicate their days and their nights to this work and who are stepping up in incredible ways to protect those most vulnerable to this virus. Know that your work makes a world of difference to the people that you care for, to their families, and to all of Illinois. So thank you, and now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor.
Good afternoon. And Governor, if I could beg your indulgence, I'd like to start by wishing a happy birthday to my little one at home. Happy birthday, Chica. I don't even know if she's watching. But I thank Governor Pritzker for his continued leadership during the statewide COVID-19 response. He's working hard every day to make sure that every county in Illinois has the resources they need. Everyone is working around the clock for all of Illinois, from the governor and his team, workers in the hospitals, in the local health departments, to long-term care facilities, and all healthcare providers. The people of Illinois are being well taken care of. Our long-term care residents are at greater risk of infection because of the inherent nature of living in that congregate setting, not to mention the advanced age and the attendant comorbidities. Public health will continue to work closely with the long-term care facilities across the state, calling almost 200 facilities every day to check in on the staff and ask for the assistance that may be required. We're making sure that they're employing the most up-to-date guidance and answering any questions that they may have. Limiting and preventing spread is how we will end this pandemic. Today, we are reporting that we have reached an unfortunate milestone of over 50,000 cases of COVID-19 here in Illinois. There are a total of 50,355 cases, with 2,253 new cases resulted in the last day. Our death toll now stands at 2,215, with 92 additional lives lost reported since yesterday. In total, we have run 256,667 tests, with 14,478 being run in the last 24 hours. As far as hospitalizations, as of midnight, 5,036 people were in hospitals in Illinois for COVID-19. Of those 5,036, 1,290 were in the ICU, and 777 patients were on ventilators. As we continue to live in this COVID reality, we need to continue to work together and support each other. While our physical actions, such as social distancing, staying home, hand washing, while all of those are vitally important, we also need to remember to be kind to one another and have patience and understanding and offer support. We are all going through a difficult period in one way or another. More and more of us are being personally affected by this virus. Let's be all in Illinois and help ourselves through to the other side of this pandemic. And with that, I will translate comments into Spanish. Buenos tardes y feliz cumpleaños a mi hija Chica. Agradezco al gobernador Pritzker por su liderazgo durante esta respuesta de COVID-19. Trabaja duro todos los días para asegurar que cada condado de Illinois tenga los recursos que necesitan. Estamos trabajando día y noche para Illinois, desde el gobernador y su equipo hasta los trabajadores en hospitales, centros de atención a largo plazo y otros proveedores médicos. La gente de Illinois están siendo bien atendidos. Nuestros residentes de atención a largo plazo tienen un mayor riesgo de infección debido a la naturaleza inherente de vivir en un espacio congregado. Preveniendo la transmisión es como vamos a terminar con esta pandemia. Hoy informamos que hemos llegado a más de 50,000 casos de COVID-19 aquí en Illinois. Hay un total de 50,355 casos con 2,253 nuevos casos reportados desde ayer. También reportó 2,215 muertes con 92 vidas adicionales perdidas desde ayer. En Illinois se han realizado un total de 256,667 pruebas para COVID-19, con 14,478 realizadas en las últimas 24 horas. Desde ayer informó que 5,036 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,000 290 pacientes estaban en la unidad de cuidados intensivos y 777 pacientes estaban en ventiladores. A medida que continuamos viviendo en este mundo con COVID-19, necesitamos continuar trabajando juntos. Nuestras acciones físicas, como el distanciamiento social, quedarse en casa y lavarnos las manos, son de vital importancia. También debemos recordar ser amables, tener paciencia y ofrecer apoyo a nuestros vecinos. Muchísimas gracias. And with that, I will turn it back over to Governor Pritzker.
Thank you very much, Dr. Zika. I'm happy to take any questions. Hi, Elizabeth.
Good afternoon, Governor. Hope you and Dr. Zika are well. Quick question about the nursing home statistics that you mentioned earlier. So all staff and residents at homes without cases are being tested, correct?
We're in the process of that. Yeah,
Process.
we don't have enough to do it all at once, so we're getting to all of them. But I think I said 68, and I think that's the number so far.
And then you mentioned the nursing homes with cases, with positive cases, all staff are being tested, or that's what we're shooting for. Does that also mean residents there are being tested, or just those that are symptomatic?
So the local health departments, what they typically have chosen to do in these circumstances is to test people who've been exposed to those, any staff person that may test positive, or any other person that may have tested positive. And so they'll test those who've been exposed, but they'll assume that everybody needs to be isolated. And I think I have all the details of that right. I want to make sure I'm looking at the doctor because, as you know, IDPH oversees this. But it is very important that we keep everybody safe in these facilities. And honestly, if you assume that they have COVID-19, you're going to give them the same care that you would for somebody who is COVID positive.
Sure, okay. Lots of questions about the second lawsuit that's been filed, Representative Cabello,
Yep.
broader than the first, and kind of giving you an opportunity maybe to revise the extended stay-at-home order before a hearing on Monday. Your thoughts to that? Are you considering it? What do you think?
No, I think it's a similarly irresponsible lawsuit. We're in the business here of keeping people safe and healthy. That's what the stay-at-home order has been about. And I just think that lawsuit is just another attempt at grandstanding.
In the same vein, Eric Hong with ABC7 wants to know, does the litigation have a point? Argues that many mom and pop retailers should be allowed to open if big box stores are operating. Similar shops can observe similar social distancing protocols. Why not allow those small business owners to do more than just drive up and delivery?
Yeah, one of the challenges that's come up during this crisis has been that, again, the list of essential services and businesses that are open focuses in part on grocery stores. But as you know, many big box stores have a grocery store inside them, which allows them under this order to stay open. They also have other aisles and other products that they sell. So that's one of the unfortunate challenges of this. Small mom and pop, as Eric is calling them, stores, the small business people, what we've tried to do for them is pick up and delivery for any kind of retail establishment to give them an opportunity to reopen. I am most concerned about those small businesses. It's one of the reasons we created, even in addition to the PPP program at the federal level, which I don't think has been great for those small businesses, we created a grant program at the state level to just provide $25,000 grants to local small businesses. There is no doubt about it that the first thing that I want to be able to do across the state is to open up those smallest of businesses. Those folks have risked their lives, risked their livelihoods rather, all of their savings to open up a business, and along comes this terrible pandemic that no one expected. And it's devastating, specifically those small businesses. So we're working hard to figure out how to make that happen. And of course, we will, give some guidance and guidelines for stores about social distancing, how many people can be in a space, certain number of people per square feet, just like you hear from a fire marshal, for example. But it is a top concern of mine to open small businesses as soon as possible.
We have a very similar question coming in from Greg Bishop at the Center Square, also from Craig Wall, Channel 7, and my colleague Mike Flannery, Fox 32.
All with the same question?
Pretty much.
We're on the same conference call?
I'm trying to tie them up with a bow
Great,
here
thank
today. So In regards to this second lawsuit, they're also hoping, the legislator can get back. They want to have a conversation about all this. Is that a possibility? Why not work with the entire legislature to pass a law clarifying such powers in order to be able to go back during a situation like a pandemic?
Understand completely, and just please, everybody should understand that under the executive order, the legislature has the ability to meet. There's nothing barring the legislature from meeting. Obviously, they have to follow social distancing guidelines and other things, but they are considered essential, as are governments around the state. And so that's something that'll get decided by the leaders and the members themselves about whether and how to meet. I have suggested to the legislature that if they want guidance, and I think they will want guidance, about how to do it safely, because that's the most important thing. We just don't want anybody getting sick. As to whether they meet today, a week from now, or a month from now, whenever that may be, we need to make sure that all the people who work in the Capitol for those legislators, as well as all the legislators, are safe. And so I have suggested to them they may want to get guidance from our IDPH or from epidemiologists, well-regarded epidemiologists in the state who would know how to design a plan for them to meet.
Has anyone asked for that guidance?
Yeah, the legislature, several of the leaders asked to know what would that look like, and so there was an outline provided to them of what it could look like. But not knowing the details of how the legislature wants to do this, it's hard for guidelines really to be written for what they want to do. For example, are they hoping to have committee meetings? If they are hoping to have committee meetings, how do people participate in that? How is there an audience in a small committee room when we can't have gatherings of 10 or more in a closed space? So those are complicated, and I just don't know what the legislature will want to do in that regard.
What about a virtual meeting? Is that a
it's not
possibility?
allowed by law today, but absolutely they could. I know that the city council in Chicago has met by Zoom. I know that some of the aldermen don't feel like it's a very effective way to meet, but they are at least meeting. And so, that is something that the legislature could do, but in order to do that, they would need to meet in person and to pass a law to allow distance meetings.
So how would that happen? How do we get that ball rolling?
Yeah, I would say it's back to the legislators themselves. I mean, honestly, this is not it's not, forcing people somehow. I'm not going to go, push legislators. And they are, as many have pointed out, a co-equal branch. They do have the ability to make their own rules and make their own decisions. And that's something that's completely, on them. With any advice we'll be able to provide to them.
Kind of a more specific question from Craig Wall, Channel 7. Bill Brady suggesting today maybe wearing masks, putting up plastic shields, or maybe even meeting in a place like the United Center. Mm-hmm. Why, if the Department of Public Health can set regulations for how grocery stores can safely operate, can't the department set guidelines for how the legislator can convene to do its work?
Well, so we will and do, and it's kind of the same answer, and I don't know whether they would recommend wearing face shields or surgical masks or N95 masks. Again, I'm not an expert, and honestly, I think that if you think about it, there are 177 members of the General Assembly. And then when you add just even one staff member per legislator, you're at the 354 people. And then, of course, there are security people at the Capitol and others. So, when you add all that up, it's quite a lot of people. And in theory, you could meet anywhere, but of course, that too would be an expense that would have to be borne by the state, but it's doable.
And finally, in this category, David Gracing with the Better Government Association says if they can't meet, what damage is being done due to the legislature's inability to function during the COVID-19 pandemic?
Well, this COVID-19 has just been horrible. I mean, it's been the effect on people's lives, the effect on the state, the ability of the state to move forward. Think of all the things that we knew that we wanted to accomplish, and I've talked about accomplishing this year that I believe in, not to mention people who may disagree with me and the things they want to accomplish for the year. The idea that the session has been so delayed. Now, remember, it is possible to meet at any time. It doesn't have to be today or next week or even next month. It really could be at any time. And again, that's up to the legislature. If I started dictating a date for them to meet, I'm sure that there would be blowback from legislators, and so I have left it to them to make decisions.
Okay. Now we have the miscellaneous categories. So Tony Arnold with WBEZ says, is there any legal advantage to bypassing the 5th State Appellate District and taking your appeal of Representative Bailey's court case directly to the state Supreme Court, considering that appears many more lawsuits are coming?
That has been done, that filing, or at least the filing with the 5th District. As I understand it, the Attorney General is filing an appeal with the 5th District and simultaneously or moments after filing for leave to take it to the Supreme Court.
Okay, here's a question from downstate Mark Maxwell of WCIA. He says he's getting this from several veterans. It's a Class 4 felony in Illinois to carry a concealed weapon while wearing a mask. Technically, prosecutors could charge a legal gun owner for obeying your executive order. The order doesn't take effect until Friday. Why not use your executive order to temporarily suspend that portion of the law?
So actually, we've allowed the state police to set some guidelines here, and it doesn't prohibit people from concealed carry. The rule that we put in place would not.
Sarah Schulte from ABC7. Some frontline healthcare workers are using shower caps and rain ponchos for PPE. Is that appropriate?
No, they should be provided PPE by their hospital, by their healthcare facility that they work for. We, as I have said, we have provided to every county health department and to hospitals and others across the state the PPE that they've asked for. Indeed, we are trying to keep some sense of the inventory that exists, and the inventories exist. So if there are healthcare workers that are not being given PPE, first they should tell their supervisor, knowing that there are stores of PPE at the facility. Second, if that is not effective, they should call their county public health department, who has received deliveries from our IDPA, from our IEMA rather, of PPE. And we have PPE in this state. You know, we are constantly ordering more. We have, you know, as I mentioned, there's sort of a shortage of gowns, but as to all of the PPE, that should be available to those folks when they go to their healthcare facility.
What about those stories about those healthcare workers? They complain. Some of them say they're losing their jobs if they're complaining too much.
If they're complaining too much, that frankly, they should report that to the Department of Labor. Complaining, I mean, I'm not sure, you know, to what extent this is about complaining or if
about
it's
PPE.
Yeah, right. And so then I would say that is an inappropriate way to operate. If a facility is firing somebody for asking for PPE, especially given the moment that we're in, I mean, honestly, our Department of Labor, the Attorney General's office should hear from those workers, because those facilities are not operating within the parameters that we've asked them to.
Ben Bradley with WGN asking a question for Dr. Ezike. We're hearing from the families of medically fragile senior citizens who lived in nursing homes, were hospitalized with COVID-19, recovered, and are now concerned about returning those seniors to nursing homes where there's a current outbreak ongoing. What is the recommendation for these folks?
Yeah, so we know there's a concern for anyone going into any facility, because we know that essentially there's COVID-19 virus. The virus is everywhere, but specifically for people returning from hospitals, I have heard of issues of people not being able to return to their home. The nursing home is, in fact, their residence, and so there should be a process for everyone being able to get back home. For concerns regarding spread of the virus, again, all of the nursing homes, all the long-term care facilities, that's what we've been talking about every day, about how the appropriate infection control standards are supposed to be abided by and followed so that we can limit transmission of this virus even in the congregate care setting. So again, working with the staff, the medical team on hand, working with the county local health departments, working with IDPH, we are trying to make sure that everyone is apprised of all the infection control rules, that they're following them, that they know how to appropriately put on and take off the PPE. If there are issues in terms of getting the PPE, the governor has spoken over and over and eloquently about the process to be able to make sure that everyone has what they need. So all of those things being considered, people should be able to return to their place of residence, and they should feel that the staff in place is taking all precautions to prevent and limit spread.
Thank you, Doctor. Steve Bertrand with WGN Radio. Possibly another question for Dr. Ezike. Do you have data on what populations are making up the newly infected cases? We've been staying at home for several weeks, so are the new cases primarily essential workers, or are people who are staying at home still getting sick anyway?
Well, just to review how this virus is transmitted, if you have